All righty. Mic check. Good afternoon, good morning, good evening. It is October 11, the beginning of term 5. This is Dr. Nelson Garais. I am your instructor for this class, MIB130, Diseases of the Human Body. And this particular course is OL, online. Okay. Here is my contact information, my cell phone. Please text me first because if you call, even on the weekend, I tend to pick up because it is a business phone. So text me, or you can email me. I try to deal with all correspondence within 24 hours. If I don't answer you back within 24 hours, it most likely means that I did not get the message. So please utilize this communication and check in with me often, especially if you don't know what to click on and where to go. And click here daily because there could be announcements daily. And make sure you also check your Stratford University email daily because there could be messages from different departments. And I will put this welcome video here in the announcements. So welcome video instructional. Recorded session, I guess that's what we call this. Here's the link to today's or this week's video. And this is week 1, term 5. I'll put this link right here. Okay, so let's post that, and I'm gonna add that link later. So always check into here. You also have library and other things here. I hope you guys already checked in and looking around, and let's see how many people are there. Let me look. There's no grades in yet, and it looks like I have about a dozen or so. And I know some of you, I've had some of you before, and for those of you I haven't had yet, welcome, welcome. So how are you to be graded? It is an online course, and you'll see that there are 10 weeks, and just think of it, every week is worth 10%. So this week, items that are due by Sunday, the midnight, the 17th, you have your cardiovascular interactive module, you have your fact sheet assignment, and your discussion 1. And the grading is from 0 to 100. And if you are late, for every day you are late after the Sunday midnight due date, I have to chop off 10% off that grade. So let's say, for example, you should have gotten a 100 on your cardiovascular interactive module, but you did it and finished it 2 days late. So that's 20%. You get an 80 when you should have gotten 100. And honestly, you're healthcare professionals, or on your way to become healthcare professionals. Please, on time is late in the medical world, because if you're late, even especially even with if you have an administrative position in the hospital or wherever, late tends to hurt people and in an extreme form potentially kill somebody. So we don't want to be that person, and we don't hire those kind of people. And if we do, they don't get to stay very long. So you can click here just to begin, right? It's like a little bit of introduction. Now that you know every week is 10%. And what is this course? If you recall your medical terminology, what's pathology? Logi, study of patho disease. So you're going to get through these interactive modules that get you through kind of like a simulated story, like you're the clinician or you're the person doing the investigation into the particular case or disorder, and then you get to see signs and symptoms. And remember, signs, if you recall your medical terminology, sign is an actual objective thing, like a fever with 40 degrees Celsius. It's an actual evidence. And a symptom is how the patient feels. So the patient could feel feverish but they could also have um, a temperature that is normal. But them feeling feverish is also something to consider. If you recall, the four basic parts of your typical data and or clinical chart is subjective, objective, assessment, and plan. So the subjective part is, of course, the history, and that includes what symptoms, what does my patient feel. The objective part is what signs, so what laboratories and what things did I find upon physical examination. And of course, assessment is the diagnosis, and P is the plan or management. What are we going to do? And for those of you who are future medical billers and coders, and also healthcare administrators, you need to know this stuff as well, because billing requires what? Codes and coding. And they understand you can't get paid unless those codes are dead on. So you have procedural coding, and of course you have your ICD-10, which is your diagnosis codes. Etiology, where does this come from? Diseases don't come from out of nowhere. There is a source, and that's what your etiology is. And of course, the assessment part, which is the diagnosis, and a little bit of the treatment, which is your plan and or management. So we're going to look at, anatomical and medical terminology with pertaining to these things: the subjective, the objective, the assessment and plan, or the signs and symptoms, symptomology, etiology, diagnosis, and treatment. And that's what we're kind of looking at. So each module has 3 things that you should do. That's every week. The modules are once a week, culminating in a week 10. I believe it's a final exam. I believe it's online because everything is online here. Let's look at week 10. What's that? That's not me. Oh, here's a final assessment, of course, is your final exam, and here's your final survey. Let's see, I think it might be in module 9. Yeah, it might be in here somewhere. If not, I could easily post my version of a final, and I could post it in here, of course, in your announcements. Okay. So that's this class. And if you got a moment, introduce yourself. I have a little ditty about here. And so this introduction is also a little bit about who your instructor is. I started off like 30 plus years ago as a medical assistant, then became a medical biller and coder, then became a office manager. What else? Medicaid, Medicare arbitrator. Then I went to school and finished a double major at Fordham University, biology and chemistry. Then I went, finished my master's degree in physical chemistry at Rutgers University. Then I went to UMDNJ, University of Medicine and Dentistry of New Jersey, got kicked out for academics. Then went to back to my home country in the Philippines. I graduated the University of Santo Tomas, class of 98, 99, around there. And then I went back to Rutgers, finished off my 5th pathway, then took my boards, and then I worked for about 5-6 years as an internist at Lincoln Hospital in the Bronx, New York City. So that's a little bit about myself. So you can see that I've held a whole bunch of positions from all the way from like medical assistant all the way to being a doctor. And also same thing with education. I've held multiple positions, including faculty coach, student services, did that for a year, and also career services. I did that for a year. I've been a former dean, former director of education, former vice president of academics. So ain't my first rodeo. I've been around. So that's me in a nutshell. I got a ton of kids. So those of you who have children, I feel you. But I also understand that that's also a great motivator. for you know, what you need to do. So dial in your discipline and work on things little by little every day. So what are the things that are due? So the first thing you do is, of course, you see this, and then here's some resources here. You click on it, and they are websites. And the first interactive module is, you have a patient in the ER. It looks cardiovascular, of course, because this is the first system we're going to be talking about is the cardiovascular system. Of course, the heart and all the blood vessels, and also the lymph vessels, which is a little bit about your immune system. So you click on this interactive module and try to be on, and then you click on here, this enter. Try to be on something like, don't use Internet Explorer, or if you're on a Mac, don't use Safari. Use, Google Chrome, or what am I using? I'm using what I should be using, Firefox. Okay? Because I don't know why. For whatever reason, of course, Internet Explorer is glitchy, and also Safari is for Mac is also glitchy when you want to do these interactive. Now, what does it do? You click on it, and then it plays like the videos, right? And then it asks you like
Did you read any clues?
Ask you, so go through all of these and take your time. Just don't go click, 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 click. Take your time and kind of immerse yourself in it, because it's actually a better way of learning. You learn things via like through a case study from beginning to end. How do things go down with this particular patient? Okay, and take notes because I need it. Now you got a fact sheet here. You click on that and you click on this fact sheet, and then of course you open it, and then it'll have a bunch of questions. You of course save it, and then you could and of course, what I would do is I would print out this fact sheet or have it here on the side. So as the case is going down, I could, fill it in and read it first. So what disease state, and short answers, don't need a book. Now let's see this. Now online discussion, I'm going to talk about in a minute on how do you maximize your grade for online. So that's that fact sheet, right? And you should complete that. So that's due. Finishing up the interactive module and answering all those questions on the fact sheet. That is due by Sunday. All of this week 1 material for module 1 is due Sunday, October 17, midnight. Now here is, I think it's the same fact sheet. Yep, it's the same fact sheet. So this is where you submit your fact sheet. You submit it here on the right side. And the best bet of when you're looking at an online classes, you're always looking from left to right, top to bottom. So I would do the interactive module first. Of course, print out that fact sheet and get that fact sheet, right? Right. So because you're going to need the interactive module to answer the stuff on the fact sheet, right? And then now the discussion. So you review the case and you answer the questions. Now, what do we need? What do we need for your initial response? So your patient, Ed, which coincidentally, my middle name, what symptoms? You already answered that on your fact sheet, but here you get to expand on it. So what is angina and how does it relate to coronary artery disease? So, and what information might be helpful to know in how to assess the healthcare of our patient. Now, I know this is for a non-clinical class, but you gotta, as a future healthcare administrator, you really should understand what the clinical people have to do. Actually, my wife works for Inova. I also have a couple of students who work for Centara. When they were all interviewed, they were all asked the same thing, like, how was their knowledge and understanding about what does the clinical side of the hospital get to do all day? And fortunately for my wife, used to be in a nursing program, used to be a former CNA. So, you know, she could relate to this. And you guys going through this course, you could do the same thing. So how do you maximize your grade? How do you get a 100 points or 100? So first, you have to have an initial response. And your initial response should be at least 250, 300 words, give or take. And it should have these items in it. Okay, so let me open this. You should have an introduction. So for this particular case, let's answer these questions. I'm going to copy it, put it on this Microsoft Word document. So you have to have an introduction. So in your introduction, you answer the questions. So, and you answer it in full sentences and in paragraphs. So real short, what symptoms, just explain the case and what symptoms is our patient, Ed, experiencing, okay? What is angina and how does it relate to coronary artery disease? You could Google that, okay? And make sure you cite it. Seventh edition, APA format. If you don't know what that is, you go here on your Moodle page, hit library, hit APA sources. Another thing you can do is hit here in your main front page of your course shell, right? And then click on this website, APA 7th edition resources, and how to cite things. Let's go back to our discussion. So what symptoms is Ed experiencing that suggest there might be a problem? Okay, so tell a little bit about the case, and, you know, and as if I never read it. And then, what is angina? Is Ed experiencing angina? Cite your source because you have to have a medical definition of what angina is. You also should have a medical definition of what CAD or coronary artery disease is. And does it look like Ed is experiencing that? Was it part and parcel of the doctor's assessment or diagnosis? Put that in your introduction. What other information might we need to assess their health? Now, it goes, of course, you're not a doctor, you're not a nurse, or you're not a doctor or nurse yet. What other information was important from the case to assess their health? And let's see, go back to the module. And how would this information help our case? So let's go back to, where's my Microsoft Word? There it is. So what information, and I want you to start thinking of management. What are we going to do for that person? What kind of drugs? What kind of, do I have to run more tests and all these things? So you have an introduction introducing this stuff. You have a body. That, you know, you use as evidence. And you could expand on the ideas that you introduced. And then what's your conclusion? My conclusion, Ed is in a world of hurt. He shouldn't make any plans. He may die today. Or your conclusion is, I think his prognosis is good based on this, that, and the other thing. Okay? So that's how you do, let me make this all in one font. It's annoying to me. So that's how you actually do a discussion. And I see there's some people with discussions here. I'll be replying to your discussions. And, you know, and I'm sure maybe they're complete, maybe they're not, but I'll reply. Now, when you reply to somebody, you do the same. You don't just say, "Oh, I loved your post." If I'm replying to somebody, and you know what? Let's use Miss Tyler. She's the first one up. Okay. So right now, it's good. It's a good start, right? But it needs to be expanded. So I could ask, Because the symptoms. Okay. I need your, and see how that's not in, it's just the website. APA format. And you can look it up. So for example, one other way to do this to expand it, and thank you, Ms. Tyler, because we're all going to read each other's anyway. And it's a learning experience, of course, right? So now, since Ms. Tyler did it early, she'll now have the opportunity by Sunday to do what? To do a better post, okay? Because it's only this afternoon, so almost evening, that I posted, what's a good. So you need your citation and at least one in 7th edition APA format, okay? And you try to find something that's like .org, .edu, .gov. So like, for example, I want to look up the definition. I want to Google the definition of angina. Right? Expand on that definition. Don't just pick this, right? Oh, look, how do you fix? Is it life-threatening? So she had this. It's a June 12, 2020. Oh, good, right? So she can talk about these things and how they're all related. And here's a neat part. I could take this, copy it, find something like bibme.org, or there's a whole bunch of places that can make citations. I could make a citation, APA. I got it from a website, or Ms. Tyler got it from a website. She did the work. I put in the website right here. This is the website, and you can see it filled out everything for you. Click on final step. Just follow the, so it has no author, boom, 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 boom. Create the citation. And it's right here. Copy and paste. You go back to the thing. Here's an example of your citation. Of the citation in your post. So now we know exactly, and we got it from a legit source. It's a .org, it's Mayo Clinic. Look up, use .org, .edu, and if it's a .edu, make sure it's a medical school or a nursing school, or a .gov like National Institute of Health, CDC, or Department of Health, or things like that, things of that nature. So that's one thing. Also, she started off good, and we need to expand. Okay, so why is it important? Now, if you do things early, and let's say you didn't expand it yet, I can give you examples to expand it. Now, if you don't do anything about this and just leave it, then you're going to get a lesser grade. But if you do things early, send it to me early, and you expand it, and what are the differences between the types of angina? Is there any difference in the management of the different types of angina? Okay. So you can actually write a textbook about this. Okay, what happened? Okay, and if you look at this, thank you, Miss Achuo, if I'm saying that correctly. She expanded it. Okay, now you see this? These are different types. Oh, good. The references to now, and she put a reference here because if I did this, and she didn't. She got it from, oh, so you see that? Stable in China. Okay. So, you see here? What was the, okay. So the professor can also look at this to see how much this matches. Okay. And you can see how she had her introduction. And then now the one thing that's missing here is, okay, you got it from the American Heart Association. So which part here did you get it from the American Heart Association? Is it this? Is it this? So that's another thing to also consider, like that you put an in-text citation, like according to the American Heart Association, angina, blah, 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 blah. Okay. And remember to paraphrase. Okay. So like if, let's look at her original. So what do we mean by paraphrasing? Okay. So you can't just copy and paste this, but you got to change the words around. Okay. And if you don't know how to paraphrase and any of that, give me a call. Or you can also call the library on how to learn how to do that as well. Okay. And that's what I also check. But this looks kind of good. Mr. Chuo got a decent word count, right? And you have your proper APA format, right? There's no date. So try to pick something with a date, because we're looking for 2020, 2021. So we look at this, it's from it's from American Heart Association. Let us see if, when was this updated? The date should be somewhere in the bottom. It's copyrighted 2021, so it's good. All right. So that is your discussion. And how did it not reply? Oh, that's messed up. Discussion 1. Didn't reply, but at least you have this video. Oh, here it is. My reply. Okay. So now when you reply to other people, at least reply to one person. So when I'm replying to somebody, you make sure that you address them respectfully. And of course, I use your title, Ms. Tyler, right? And then I have a a closing. I tell who, even though it's going to tell you who it is, but it has a distinct beginning, middle, and end, and of course, full sentences. So when you reply to somebody, like let's say I want to add to her discussion. So is chest pain the only issue that brought Ed to our ER, right? And what kind of angina do you think that Ed has? And then you could add that in here as well. And to make your argument better, you find a citation. Okay. All right. So we'll be discussing more on how to do a proper discussion as the weeks progress. But 250 to 300 words with at least one 7th edition APA citation, and with and make sure you refer back to that citation. You don't just put one in there. So go through the interactive module, answer the discussion, and then answer the fact sheet, and then submit that Microsoft Word document with your answers on the fact sheet. Oh, and by the way, you have your fact sheet. Let's say I'm making my fact sheet, okay? Right? Put a title on it, or I'll double click above here, in the header, and put your name. But what class is this? 130. Put the date. and put what assignment it is, so that when I open it, I know what I'm looking at. And the assignment is, what is it, week 1? Fact sheet, what is it, cardiovascular case? Now that's neat if you put it in the header. So you double click on the space, that's above, right? And you could take that, please answer it. And then just answer simply here. What do you think the patient has? I think the patient has endocardial infarction due to the following symptoms. I'm not saying that's the answer. I'm just, short questions. And another thing you could probably do is maybe bold it or put it in another font, or actually do the exact opposite. You can bold this part and then answer. Take out all this extra. Why does this have to be so huge? Right? And then answer away. Okay. And then when you save it, okay, where'd it go? Oh, I clicked save, didn't I? So when you save it, do the same thing. Student name, week 1, and what class is this? MIB130, and then put the date. And put only dashes, because if you put slashes, it messes up the. It doesn't like that kind of thing. Okay, so that it's easily identifiable, and keep a copy for yourself so you can utilize it for study purposes. Okay, so interactive module, go through that. Answer your discussion, 250 to 300 words. I see both, there are 2 of you already got it done. Good on you. And fact sheet assignment, and then you turn it in here. If you have any questions, comments, shoot me a text or shoot me an email, and my contact information is here. Okay. So with that being said, I will end this recording, and then I'll try to make a recording every week. But once we start get rolling, you should be able to do this course by yourself. And again, if you have any confusion, give me a call. And the modules are due the following Sunday. So this week 1 started today, October 11th. This module 1 material is due October 17th, midnight. Okay. Enjoy, everyone, and I'll hopefully speak to you soon.